like to thank y'all. I like to thank my preceptor. Lit. I just got online to check my clinical soap notes, my last 2 for the semester. If none of you guys watched my semester recap, go check it out. It's very informative. It tells you how I've been doing with the semester, how my grades have been. So if you watched that, you knew I was struggling with what my preceptor wanted for soap notes. Guys, your girl got 100 on her last 2 soap notes. Like, I like to thank my mama. I like to thank y'all. I like to thank my preceptor. Period. I'm so hyped. So that really got me in the mood. I've been checking for these grades for a while. So yeah, they're looking great. 100s on the last 2, clinical note 9 and 10. Those I think are the only ones. I think we only had 10 for the semester. So I actually banged out that other one extra early, thinking it was due later. So right now I'm getting ready to go into... Actually, I need to go in and log my clinical hours for today, at least, so I have that up to date. I have to catch up on that so bad, guys, like just going through and adding in all the patients that I've seen. I have like a crap load list, but I want to start doing this shadow health because it is due soon. So we also have a tornado watch. Like, I'm so confused. But anyhow, let me go and log my time, and then I'll show you guys this shadow health. Okay guys, so we're gonna hop into the shadow health, but before I hop onto this, basically with the shadow health, it's kind of like your clinical patient or your case study at home. You get a virtual patient, you work that patient up, you come out with a differential diagnosis and basically a treatment plan for that patient. So it's kind of like I said, I'm already in my clinical mode. I was like, what is on my forehead? I'm kind of already in my clinical mode, so it's best for me to go ahead and get this done while I'm still in that mindset. So I did pull out my textbook. If any of you guys do not use your ebooks on your iPad, I think it's the best thing ever. There is a search bar at the top. You simply type in what you're looking for. As you guys can see, I typed in chest pain. It's highlighted all through the book, and I just brought up the quick section just to refresh my memory before I hop on this case, just so I know like what questions I'm asking, what data am I collecting. One of the hardest things I found in NP school is when you are studying your specialty, and I'm saying this in the most humblest way, you feel like I'm a cardiac nurse, so like I feel like anything you tell me about the heart, like, sis, I got you. Like, came in with chest pain, okay. CPK troponins, okay. EKG, okay. Do you have a cardiac history? Are you on any beta blockers? Are you on any antihypertensives? Are you on anything for angina? Okay. Tell me when the chest pain started. Tell me what makes it worse, what makes it better. Tell me about your family history of cardiac disease. Tell me if your lipids are out of control. Tell me, have you had a stroke in the past? Tell me, do you have a history of like acid reflux? Tell me, have you had pneumonia recently? Like, I can spit this stuff out to y'all quickly, but those are the parts of your advanced practice that you need to study the most, because sometimes I think we get overwhelmed and we think we know everything, and we don't know everything. There's always more to learn. So that's why I pulled out this good old textbook. I'm gonna go through real quick and see what else I need to, gather from the patient to make sure I'm making the proper differential diagnosis and treatment plan. And then of course I already reviewed some of my assessment stuff today while I was at clinical, so I would know what part of the assessment plans what part of the patient physical assessment that I really have to focus on. So I'm gonna give you guys like a little this little shadow health, and then hopefully I pass it. Okay guys, so this is what shadow health looks like. So as you can see, they have our little virtual patient here. They give me some background on him. So right here is like some of his home meds, allergies, immunizations, vitals. So basically anything that you would have someone do on intake of him at the office. And then you basically start your exam. So I'm gonna start my exam a little bit, and then you guys will be able to see the first couple moments, and then I'm just gonna take a little bit of time to focus and hopefully get a decent grade on this, and then we will check in afterward. I've washed my hands and now I'm ready to greet my patient. And the good thing about this too is you can talk into the microphone. It's not always the most accurate, or it doesn't always say what you want, so I just end up typing.
Hi. My name is Brian Robert Foster, and I was born on August 17th.
Thank you, Mr. Foster. And can you tell me why you came in today? Sounds a little harsh, but that's what we say in the office.
I've been having some troubling chest pain in my chest now and then for the past month.
All right, let's get started. And then they have like these things on the side that tell you, oh, you should have empathy during this time, or you should do education, and you're supposed to do that through your exam. Just like if I was talking to a regular patient in the office, like if they're like, oh, I've been having chest pain for a month, I'm like, oh my gosh, I'm sorry to hear that. Well, let's figure out what we gotta do. Okay guys, so we did not do bad. My overall score was a 94.8, which I will take for this. They do this little breakdown that just shows you like your performance. So I was proficient in the examination, subjective, objective, and etc. So it shows you out of the subjective data collection, I was able to obtain 27 of the 30, and wow, 33 out of 33 for objective. I was really shocked because the heart sounds in here kind of tripped me up a little bit. We always, like me and all my other classmates, get mad about the education and empathy because like honestly, like are we really getting docked for that? But whatever. I'm hitting y'all. And then I spent a total of 98 minutes on this case study assessment. So I'm gonna go through here real quick and I'll just talk you guys through everything that I pretty much said and did for this patient. There's obviously no lie that cardiac is my jam. So I'm just going through the data that I collected from the patient that they said I missed, and I think they said I got 27 out of 30. So I just forgot to ask the patient about past cardiac tests, which this thing is hard because like when I was talking to the patient, I did ask did they have a cardiac history. So I would think that would come up, but they actually put that if I would have asked, the patient had a recent EKG and an annual stress test, which I included the stress test in my plan. So that would help me rule out an unnecessary test and also have something to compare it to. I also forgot to ask about access to healthcare, which is very important, especially for me personally, but even in general, that's like one of the main things they show us in the beginning, because a lot of people, while we, you know, go through the patient information and things like that, it's important to really ask them, how often are you able to get to your doctor? How often are you able to keep up on your med refills? Can you afford your med refills? And like, you want to ask these questions in ways where people aren't like offended. So like, primary example, I asked him, I said, how many times a day do you usually take your blood pressure medicine? And then I just asked people, do you have any issues taking your blood pressure medicine? Are there any side effects? Do you ever feel like you don't have enough? So it's kind of with me asking without coming right out like, oh, you can't afford your medicine. But one thing I did go through is the heart sounds. So I heard S1, S2, S3. A good way for you to hear, I always teach my new nurses this. So S3 sound like Kentucky. So like a heart is supposed to be loved up. Kentucky, that's a S3. And then S4 is Tennessee. Tennessee. So like the 10 part is the S4 because it's so late in the heartbeat that you hear it in the beginning of the S1 almost. So it's real, like I literally, when I listen to people's hearts, I'm literally saying Kentucky, Kentucky, Tennessee, Tennessee. If you hear any of those states, it's a no. So he had a Kentucky sound, so that was S3, and that's usually considered kind of like a gallop. So I just marked gallop. I was like, oh, I'm not sure if that's really a gallop. And he also had some crackles in the bottom of his lungs. I was like, oh no, sweetie. There were some crackles going on. So that was that. And then I'm just going to go to the documentation real quick and see how I did. So model documentation, I don't really care about that. I just want to see what they put for their recommendations. So they put, based on their abnormal findings, coronary artery disease with stable angina. Yes, that's what I put for my like working diagnosis. Congestive heart failure. How did I not put that on here? But I knew I was thinking about that because I heard the lung sounds. Carotid disease, aortic aneurysm, pericarditis, I did put on here, and GERD. And then they put he should receive a 12-lead EKG, chest X-ray, lab workup to confirm diagnosis. He should be referred for echo, stress test, carotid Dopplers. They said prescribe him ditalizam and a diuretic in addition to his daily lisinopril and atorvastatin if he needs an ACE to manage his hypertension, and PRN nitro for the chest pain that does not subside with rest. So now nurses are like, what are you talking about, Shay? So basically, in a nutshell, I pretty much said the same thing, and this is where I had to like, I'm like, all right, I need to use my like background as a cardiac nurse, but I also need to like put this in provider view. So I basically said the same thing. I said he should undergo testing to rule out differentials. Basically, we do a cardiology workup. I recommended him personally, in my opinion, to the ER. I mean, the things that really stood out to me was he had those crackles in the bottom of his lungs. He had that S3 sound. He also had a bruit on auscultation. So that's like when you listen in the carotids, like the neck vessel, and you hear that like sound, that abnormal sound. So based on all that, I honestly said, in my opinion, and it might just be because I'm a hospital nurse, I said he should go to the hospital. He needs a full cardiac workup. I put CPK troponins, which are like cardiac enzymes, myoglobin, some other stuff, a full lab work assessment. I did talk about also he might need to undergo echocardiogram and nuclear stress test while in this care. And I also put in here that he should also get a scan just to rule out PE. I have seen silent PEs before, like people are just like, I have some chest tightness, and next day I come in and they're in ICU. So it's just like it's hard because my preceptor always tells me in primary care you have to know a little about everything and not a lot about nothing. Is that what she says? So basically it's saying I have to know a little of each system. I can't like just be like, oh, cardiac, oh this, oh that, and I can't work up everything in its extreme. Now in his case, I feel like me as a provider, I would have sent him to the ER because there's a lot going on. But then I have stipulations when I think about that, like, am I just thinking that because I'm a cardiac nurse, or am I really like, I don't know. So this is where I'm still in my like little phase of NP student versus bedside nurse versus almost NP. It's like, okay, what am I gonna do? But thank you for coming to my TED Talk. So we got our 94. Like I said, I'm very happy with that. I'm getting ready actually to find something to eat, guys, and then well, oh, I gotta wash my hair tonight, so we'll do that. But I'll see you guys in a little bit. Let me charge my camera. Okay, y'all, I'm getting ready to eat. Please don't judge me. I know y'all see in the background that my calendar still says September. Y'all, this is the life of nurse life. Like how I told y'all stay organized and stuff. I was just talking about that at the beginning of the video. But I'm gonna make me something to eat or just warm up something real quick and then get ready to do my hair. I was cracking up because I just texted the girl that's doing my hair tomorrow, and I just asked her confirm my appointment for tomorrow. I'm getting ready to wash my hair. Is there anything that you want me to avoid putting in it? Because I know sometimes when people braid, they don't want like oils and grease. Now I oil my hair after because I have dry scalp, and I told her that. I said I usually grease after I wash because my scalp is dry. But I asked her if there's anything she wants me to avoid, because I know some people don't like that. And she was so nice. She just told me oil is fine, but just not too greasy, so she can at least grip the hair. So yeah, but I gotta eat first before I even start this long behind project of washing my hair. So I'm going to warm me up something real quick, and then we will wash this head. We will wash this head.